Sexually transmitted diseases, or STDs, are a big problem in the US. There are roughly 20 million new infections every year. Nearly half of them occur in young people between the ages of 15 and 24. Even more alarming is that these are probably modest estimates. Many STDs go undiagnosed and untreated. Others are never reported to the CDC to begin with, including human papillomavirus, or HPV, and genital herpes. So, the cases we do know of actually only represent a fraction of how many STDs are really occurring in the United States. STD testing is the best way to detect and treat sexually transmitted diseases. But how do you know what diseases to get screened for? Keep watching to learn more. So, how do you know which STD test to get? There are many types of STDs, which means there are many types of tests. Which one should you order? Testing depends on factors like your age, risk factors, signs and symptoms, and medical history. However, if you believe you're at risk for one STD, then you could be at risk for others. So, the safest approach is to go with testing that's more comprehensive and inclusive. In other words, get tested for multiple types of STDs. We all have a responsibility to get tested, not only to protect ourselves, but to protect the spread of disease. STD testing isn't only for people who believe they've been exposed. It should be part of your preventative health care and treatment. E7 Health offers STD testing and blood titers across the nation. Testing is discreet and private, and you don't need a doctor's order. We have several testing options to fit various needs. Tests are done by collecting a blood or urine sample and/or an oral swab. Patients typically receive the results within 2 to 3 business days. Now, how does STD testing work? Here's how the process goes step by step. Step 1, order your test online. Simply select the labs that you'd like to order. We offer a variety of STD tests, including chlamydia and gonorrhea, herpes type 1, herpes type 2, hepatitis C, trichomoniasis, HIV 1 and 2 fourth generation, hepatitis A, hepatitis B, early detection syphilis. We also offer 8-panel and 10-panel tests if you're looking for something more robust. These are popular options because the panels are already created for you. We pride ourselves on making tests accessible. Choose the nearest lab from over 2,700 locations around the country. Once you've paid, you'll receive your lab requisition by email within 24 hours. Step 2, go to your chosen lab for your STD tests. Walk-ins are welcome. If you have any questions, comments, or concerns, our patient services department is available to help. Call 888-362-4321 or email us at patientservices@pwnhealth.com Monday through Friday from 9 a.m. to 5:30 p.m. Eastern Standard Time. Step 3, get your results. You should receive your STD test results via email within 2 to 3 business days. If there's a positive result, the provider will call you. If you end up needing treatment, consultations with a provider are available. So, what should you do after getting your results? If your STD test results come back negative, this means that no diseases were found in your system. In this case, there's nothing further you need to do except continue to protect yourself. If your test results come back positive for any STD, the next immediate step is to meet with a healthcare provider and find out what the treatment looks like, how this might affect your intimate relationship with your partner or partners, and any additional warning signs to look out for. Responsible sexual behavior means that you notify anyone you've been intimate with of your test results. Ask your provider how far back this should go. By notifying your partner or partners, you help to reduce the chance of the STD spreading along with the chance of reinfection. This is especially important considering that not all STDs have clear signs and symptoms. You can be a carrier and not even know it, and this will only contribute to the spreading of the STD. We tend to think that STDs are something that only happens to other people, particularly bad people. However, this is nothing but an STD myth. Nobody is immune, and sexually transmitted diseases can strike at any time, even after only one sexual encounter. If left untreated, they can lead to more serious issues. For instance, unaddressed STDs lead to a minimum of 24,000 women becoming infertile every year in the US. Some STDs are curable, while others will need more long term and even lifelong treatment. But by far, the best thing you can do is avoid them in the first place. Abstinence is the only surefire way to 100% prevent the risk of contracting an STD. The next best thing is to always practice safe sex by using protection. In addition, some STDs have vaccines, like HPV. Always keep the line of communication open with your partners so that you can have honest, transparent conversations about your sexual health. And importantly, regular STD testing is going to be one of your strongest allies. Order your test today to keep yourself and your partner safe and encourage them to do the same.